Ladies and gentlemen, welcome back to another fabulous episode of the Healthcare Trailblazers podcast. Excited to be sitting here today with David Norris, who is the co-founder and CEO at Affineon Health. David is a serial entrepreneur. I had the good fortune of chatting with David a couple weeks ago and was immediately enamored with all your incredible past experiences. You've had a bunch of exits. I'm sure some lessons also along the way. That's a term I heard once. You have either exits or lessons is basically even though the exits are lessons as well, but it's a good way to make yourself feel good about things not working out. Anyway, David, thank you so much for spending time with us today.
It's great to be here, Mendel. How are you doing today?
Amazing. So right now you are doing, you're doing this incredible company, Affineon Health. You're in healthcare. We'll get to it. Intelligent inbox for doctors. Really excited to hear about it. I think it makes a lot of sense. Let's just take a giant step back. Recently, I've liked to just dive right into the present, but you've got so many golden experiences from your past and from some of these exits. So before this current company, what would you say was like a highlight of your career, and what was that, and what was your work there?
I have had the pleasure of working with a number of really talented people, and I think that's what gets me most excited. I've built quite a few companies over the years, and I have had the pleasure of having amazing people in my life as mentors, and I've built great teams. That's what gets me excited, tackling, real big, hairy business problems, applying technology, and working with incredible people.
Yeah, and you've had the good fortune of spending time, I recall just a couple of those names. I remember Mark Cuban you've spent some time with, and so some other folks. Can you say, who were some of those folks? Because I'd love to double click on those experiences.
I've had just some amazing people in my life. Bill Campbell was a coach for me and was just an amazing resource. And I was introduced to him by Howard Schultz. And Howard also imparted a lot of wisdom to me in building Starbucks from the beginning. I had the pleasure of having Mavron, his venture group, as one of my investors. And Howard is absolutely an amazing person and is a real entrepreneur, has been there, has gone through the times that were really difficult. And, those kind of people make what we do really exciting.
Is there, so you've, I got to hang out with Mark Cuban for a little bit, a couple other billionaires, but you've spent some quality time with people that are not just, maybe billionaires, but also really very, very highly successful entrepreneurs and really built up businesses. Is there kind of some common denominators from a personality or from a approach perspective that you see across, or is each one kind of their own story? And, some are wildly eccentric in this way and some are wildly eccentric that way.
I would say they're all pretty different. I try to learn everything I can learn from people. They all have different experiences. They have different, expertise. And I think you can learn a lot from people if you observe what they do and you get a chance to really have good discussions with them. So I find most of them, to be quite different. With Bill Campbell, he used to put me in a headlock. He was literally like a football coach. So every time you'd get together for a coffee or something, he would grab you and put you in a headlock. And, literally, yeah, exactly. He was very incredible personality and just had a depth of real knowledge. And, he had no pretense at all. So I feel like everybody's a bit different. And, he was certainly special to me.
Yeah. And what was the business that Howard Schultz and his investment group invested in?
I had a tech business that I built in the advertising space, and it was a very exciting business. And again, he went through with Mavron. I think they're particularly great at helping their portfolio companies. They give a lot of time for the entrepreneurs to spend with Howard and with the team at Starbucks, which obviously they've got a very, very different sort of attitude and culture compared to a lot of companies. And so I think it was just a really, really good experience. They're one of my favorite groups.
So I have a super ADD thing to hit you with. You ready?
Sure.
Okay, I have a business idea that hit me in the gym, and since you were in the space, I want to. I can't do this, so this is for any of our listeners that you want to take this on. I think this is a great business idea, but I want to hear from you being in the space. Okay, most people don't watch TV these days. The people that do watch TV are typically, I think, I haven't done the research on this either, so feel free to go validate this idea, but I'm pretty sure that a huge chunk, if not the majority of TV, plays or eyeballs come from large places like airports and gyms that are basically, they have tons of TV screens and they're just playing it. And okay, so that's piece number one. Piece number two is ads. So nobody sees ads anymore because we have this thing in our brain that just blocks ads. You don't see it when you scroll on social media. You don't see them when they're playing on TV because we literally have this like blind spot that the second ad comes on, our brain just spaces out until the ad is finished. And then you continue watching what you're trying to watch. So you have tons of TV screens playing a bunch of different channels. In a gym, typically, it'll be a line of screens above the treadmills or something like that because people are running on the treadmills and they're seeing, but every screen is playing a different channel. And so always have just all these different moving parts, and then it just makes people space out. Airport, same thing. So the idea is you basically partner directly with the locations. So you partner with the gyms or the airports, and you run ads that run across all screens at the same time. Kind of like in those movies, those apocalypse movies where like someone hacks it and takes over the whole space. So imagine like you're running on the treadmill and all of a sudden the entire line of screens goes for 30 seconds. That's going to catch your attention because everything's kind of moving around. And then boom, the whole thing has one ad and you run that for 30 seconds and then you go back to the regular programming. That's the idea. What do you think?
I love it. I love it. Yeah. But I think advertising is one of those things that's tough to get people's attention, so I think that would work, it's just like you say, that's apocalypse, hey, this will happen again.
Yeah. Yeah. So anyway, hashtag gym thoughts. Okay. So tell me a little bit about the AI fund that you're involved with right now. Sounds really interesting. What is the AI fund?
Yeah, so the AI Fund is a venture studio started by Andrew Ng, and the purpose for the group is to build companies that apply AI to solve real-world business problems. And it's a really incredible group. Andrew is one of the top 10 thought leaders in AI in the world, and he built out an incredible team that helps to literally build from scratch businesses to take a business idea and go build a company. And I co-founded Affineon with Andrew and an AI fund to attack the provider inbox and apply AI to help providers, which is a really good thing to do. And AI fund's just super, super deep on the AI side. So as you can imagine, applying AI in healthcare is a bit different than applying it in some other industries, the regulatory side. And obviously you want to maintain trust of providers. So it requires some pretty deep thought to build a good, reliable solution in healthcare. So that's what AI Fund brings to the table.
That's awesome. And what's like every different industry or every company has their own bragging rights. What are kind of the bragging rights? Is it amount of companies you've invested in? Is it amount allocated? What do you like to show off about the AI Fund?
I think AI Fund's just an incredible group of people with the biggest depth in AI. So we've built, I think, 35 or 40 companies so far with our first fund, which was around 200 million. And we're building another set of companies now with the second fund. So our ability to assist entrepreneurs in really thinking through how to take a business idea and apply AI to solve a problem and build a successful business out of that. I think that's what AI Fund's really, really great at. And it was my first time doing this with a venture studio. I've always built businesses from scratch myself. And being able to work with an incredible team of people that have such depth really gives you a competitive advantage to get to market faster.
Yeah. So did you start there and then as an extension, you found a problem and then you started Affineon, or did they happen in parallel? What was kind of your journey between the AI Fund and then starting Affineon?
So AI Fund and Andrew came up with the idea for applying AI to the inbox of the provider. And I jumped in to co-found it with them. And we obviously spent a lot of time with providers, really digging into what's the problem that we can best help with. And, in healthcare, burnout is a huge issue. Providers are just buried. And that's one of the reasons why I'm so passionate about helping providers, because I think they're in an incredibly difficult spot. They're trying to do a job that is hard, and they're trying to see a lot of patients and do good. But with all of the sort of things that are going on in the highly regulated industry, EHRs have now really driven providers to spend a lot of time behind the computer rather than in front of patients. So being able to really understand how you can help providers to spend more time with patients and less time doing all the administrative work is really why we started the company.
Yeah. Yeah. It's a beautiful mission. It's a huge mission. It's obviously one we share at Careco, and there's a lot of companies trying to tackle different aspects of this. What I like about what you've done is, you found, you haven't gone too broad. You're going deep in on a niche. And that's something that we share, we're doing similar approach at Careco, finding something and just going really deep on it. And I really do think that is the future of a lot of these companies. I think that it's about having extreme user expertise, extreme use case expertise, and going really deep on something because and I think we talked about this offline, where it's one of those things where you can't get it 80% right, because if you get it 80% right, they're not using it at all. I mean, it's just, you've created nothing. You have to get it 100% right. It has to be perfect. The workflow has to be spectacular. The ease of use has to be there. So now let's double click on the actual solution. What is Affineon? So you're helping providers manage their inbox. Give me a little more context on that.
Yeah, so if you go look over the shoulder of a provider, let's take a PCP as an example, and you look at where they spend their time in a day, there's two big areas that they end up doing administrative things. So one of them is documentation, which AI scribes and ambient are addressing, and the other is the inbox. So if you go out and ask 10 doctors, hey, what do you think of the clinical inbox? They will give you an earful. They hate it. It's the bane of their existence. It's a treadmill, all of those kind of analogies. And the problem is that they just end up spending a lot of time because if you, for example, go see a PCP for an annual physical, what do? Well, they run a bunch of tests and they probably order 4 or 5 labs. And the next day, those lab results come into their inbox. And if you're seeing 20 patients a day, that's 100 lab results coming in on top of prescription renewals and patient messages. So providers end up having to spend time in the morning really early or between patient visits or staying up late at night, just trying to catch up on the inbox. And if you get behind, then you're really in trouble because catching up can be really, really difficult. I was on the phone with a provider yesterday that was feeling really great that she had gotten her inbox down to 900 things. And,
oh my gosh.
And you think about that, that's to her an accomplishment to get to that point. Yeah. And most of us would think, wow, those 900 things are patient results that the patients are waiting to hear about, right? Hey, what are my lab results? Am I okay? And obviously the response from the provider has been delayed. So Affineon has applied AI to help providers in triaging the inbox. Much like in the old days, you might hire an assistant or maybe an RN to come in and triage your inbox. Today, most providers can't afford to do that. So they end up having to spend the time. What we've done is apply AI to do what a nurse or an MA would have done in triaging the inbox. So take the things that the provider does not need to spend their clinical time on and take care of them, whether that's CC'd labs that you need to route to staff to put in the patient chart, whether it's normal results that you just need to notify the patient, hey, your results are all normal, or if it's clinically insignificant, abnormal results where it doesn't really have any negative effect, the provider can notify the patient. So we're doing that for the provider and really reducing the volume day to day of their inbox from 30 to 80%. So that allows them to spend their clinical time focused in the areas where they want to spend their time.
So it's from what I would imagine, there's kind of 3 levels. There's triaging the content of the inbox. So deciding this is important, this is not important, this goes to you, this goes to you, this goes to you. Then there's maybe step 2 or level 2, which would be actually drafting replies. And then there would be level 3, which would be actually sending those replies. Where in that, is that correct? And where in that stack are you guys?
Yeah, so we do all of the above. So we have built a really sophisticated platform to be able to analyze results as they come in. So take lab results as an example. We can analyze them. We can apply a set of protocols to understand, should we handle this automatically or should we not? And the provider is completely in control. So they define the rules or the protocols that allow us to decide, yes, this is a lab result we can handle. And then we, after running the protocols across it, decide we can do it. Then we'll notify the patient, send the message out, and close it out of the inbox. So the provider literally has told us what to do, and under their direction, we've actually handled those. No different than an RN would do if they were handling the inbox. For those results that do need provider attention, we also prepare a summary for the provider to help them in getting through those lab results faster. So we can take a whole set of lab results, analyze them, trend them against prior results, and summarize them in a way that really allows the provider to focus on the aspects of the tests that they really need to focus on to figure out what to do next with that patient. So we help them by getting rid of the things they don't want to spend their time on, and then helping them on the things they do want to spend their clinical time on to go faster. Today, we can save about 5 hours a week for a PCP, which is a meaningful amount of time.
Yeah, it is. Yeah. Well, I'm actually, I want to double click on this because you're the first tool that I've come across that is saying that you've basically replaced something at a clinical expertise level of an RN. I mean, even that is pretty big. You're a piece of technology that actually sends things to patients. There's a huge amount of risk. So there's this axis of value for augmentation. So low, high, and then there's risk of mistake, low, high, right? You seem to be in a space where there's extreme value for augmentation or automation, but there's also pretty high amount of risk because you're actually communicating something to a patient. You're possibly communicating a clinical result to a patient. How do you approach that? And how do you approach that from a risk perspective?
It was the sort of foundation of the company that we need to maintain the trust of the providers. So we built a system that has a capability of delivering 100% accuracy. And we have a human in the loop design where we can escalate anything that our system does up to a human. And that's how we trained our system. So in the beginning, people don't often think about how many lab results are there. People, you might get a CBC or a CMP, the kind of things you get with the annual physical. But today we've processed over 2,000 different types of labs. So there are a lot of different types. And in the beginning, our system didn't know how to do any of them. So we used a clinical team to train our system on how do you handle this result and then this one. And over time, we were able to train it to be able to handle a very broad set of results. Having the humans in the loop is a key because when you run into a new lab, which today doesn't happen very frequently with us, but let's say a new type comes in, our humans automatically get engaged to be able to figure out how do you process that type of result and then train the system how to handle that. So over time, you just learn how to handle more and more, variations. And that's really the secret to our system. So we have built a proprietary data set of tens and tens of thousands of these training pieces that allow us to handle with a very high level of accuracy, 100%, the results. And that's what providers want. I often get the question, what do providers think about AI and do they love it? Do they hate it? In my experience, providers don't really care. They think of it as a tool and they just want it to work. It's like an MRI to them. They don't know if there's AI inside of the MRI machine or not. They just use the MRI machine,
Right. Yeah. I have this keynote that on the topic and I've tell you, no one gets up in the morning and says, today I'm going to use AI, they say today I'm going to do XYZ task. And if the AI tool helps them do XYZ task better, faster, and easier, then they will use that tool. And if it doesn't, they will not use the tool. It's very simple. That the example or the joke I tell is like when washing machines came out, no one was like excited about like NWT, this like new washing technology. They were just cleaning their clothes and it was easier. Like, you're trying to get something done. You're not trying to use a technology,
Exactly. And today, everything we use, whether you pick up your iPhone or whether you drive your car, there's machine learning in almost every product you use. So I think doctors really just want reliable results. That's what they care about. And they want help. And they're very open to getting help. As long as it works, they're very happy. So our attention with our product has been make it work reliably, get results that the provider really, really values and can't live without. And if you do that, they'll love it.
Yeah. So you sit at this very interesting crossroads where you are a multiple time founder, currently also in the capacity of a founder, but also sit on the funding side. So let's dig into the conversation around what's the approach to taking money. There's so many horror stories of people that took funding from people that just went really badly, but also funding is very often necessary. I think the gray area is when funding is not necessarily necessary. Because if you have an idea, but the only way to execute on the idea is take funding, you're going to sell your soul. That's just what's going to happen, because otherwise you have zero chance. So your calculation is, okay, either I can take funding and run the risk of getting in with a bad partner and run the risk of ending up with nothing, or I could just do nothing. Like, that is your calculation. So to me, that's not a very difficult calculation. I think the interesting conversation is when you're in that middle space where you can execute on your idea, maybe in a more limited capacity, maybe slower, without taking on funding, or you can take on funding and you can maybe rapidly increase your liftoff. You can increase your break into the market. So for those folks that are in that space, what's your approach to funding from, given your experience on both sides of the fence?
Well, it's a big topic. I think the environment has changed quite a bit with AI, especially in healthcare. So my general attitude has always been to take the money you need to build the business, but don't take too much. I think big businesses and small businesses, when they get a lot of additional funding, tend to make decisions that aren't always in the best interest of the business. So I think you should budget carefully and do what you need to do. In healthcare and in other industries also, with AI, the whole market is accelerated dramatically. So the competitive landscape can often really dictate that you need to bring in more money, and often money faster than might have been in the past, because it's so competitive. I'll use the ambient scribe market as an example. In that market today, last count, there were around 65 companies all doing basically the same thing, trying to differentiate themselves. So that's an example where having additional capital can really help you in growing and standing out from the crowd. Whereas that kind of scenario didn't really exist before AI. So I think taking capital, if you get the right partner, can be one of the best things you ever do. Picking the right investor that aligns with how you want to build the business and the kind of business you're in is absolutely the key. And if you can find the right partner on an investment side, it can make the difference in your business being successful or not. But finding that partner that's the right fit is the key.
What do you think is the higher risk? Finding a partner who's wrong for you, or being late to market, or, not getting to market fast enough or deep enough to really put your stake in the ground? What's the higher risk?
With AI right now, I think the time to market is probably the bigger risk. Even if you got a partner that wasn't exactly the right fit, without the capital to grow, a lot of times the way I think of it, and I advise a lot of companies and I'm on a lot of boards, if you think about it, 2 years from now, how does your company remain relevant? And I always think about that as the measure. Pick your time frame, 2 or 3 years out. If there's going to be a whole set of competitors, are you going to be in the top 2 or 3? are you going to be at the bottom of a list of 30 or 40? And if you want to be relevant, often capital is one of the important sort of factors. It's like fuel to be able to help get you there so that you can maintain relevancy. And the difference between being at the top of the list or the bottom of the list is value. So, if you're at the bottom of the list, more than likely your company will be worth a lot less. If you're at the top, it'll be worth a lot. So bringing in the fuel necessary to be able to maintain that relevancy, I think, is the key.
And where do you think the key is in actually using that funding to achieve that specific objective? Is that really just around presence and marketing and making sure you're on every billboard and everybody knows your name? Or, because the tech has to work well, whether you're a small company or a big company. Like if you're going to have customers and they're going to be happy, then you have to have good technology, right? But let's take the Scribe example because it's a good example because it's a super, super crowded space. It's also interesting to me because there's very clear winners and losers at the top. And so there's a ton of losers, like you said, there's a ton of people that are just at the bottom. And loser maybe is a harsh term. Maybe they're doing a couple $1 million in revenue, maybe, and that's totally fine. But they're definitely not, the Abridge, Nabla, Nuance. Now, what's interesting about those up at the top, Abridge seems to be the clear winner. I mean, they got in early with Epic. They have a ton of funding. They just raised again a couple, I don't know, billion or something. I don't know what they just raised.
250 million. Yeah.
Yeah. But that put them at like a what valuation?
3 to 5 billion. So
yeah,
it's pretty
crazy.
high.
Crazy. So, Abridge to me is the clear winner in this race. Nabla, and I actually talked to the Nabla folks about this. Nabla feels like they're just constantly running an uphill battle. That whole thing that I don't know how closely you're paying attention to the market. I'm sure somewhat closely, but when the whole Kaiser switcheroo happened, about a year ago at this point, where they were with Nabla and then they switched over to, and came out that their venture arm had actually invested in a bridge, and then Nabla kind of threw shade on that like, oh, what are you going to do? Wherever the dollars are is what they're going to find. And then they threw kind of shade back saying, no, that's not actually true. Without officially saying this, they were the better product. And so you kind of had this little back and forth, which, by the way, I actually think is very toxic for brands whenever you start sounding whiny. Like there's another, I'm not going to say that the company name, but there's another Scribe in the space. And they're like one of those bottom 10 scribes, but their founder and CEO is just super whiny about the fact, like as if like the market is at fault for them not being successful. I always think that's a terrible idea. But anyway, my point is that looking at the scribe market, there's very clear winners and losers at the top. I think one of the most interesting stories at the top is a company called DeepScribe. Because 2 years ago, DeepScribe was on par with they were almost the number 2 after Microsoft. And then they just disappeared. I haven't heard from them in like a year. So back to the original question, let's look at those as an example and overlay what you've talked about from funding. I think that tracks. I think Abridge had the most funding.
Well, I think it's interesting when you look at different markets. The most important element is to go fast and take market share because that's how you would win. And that's often the case in a consumer company, like a retail outlet where you just need to get presence. Other businesses, there's a technical or clinical complexity where creating a barrier to entry or a moat that protects your particular market from others entering it is more important. So it really depends on the business. I know in the Scribe market, it's much more about marketing and market share and deals because that allows you to become that brand that leads. And I think that's one of the challenges that the Scribes face is where do you go from there? You can have a certain level of dominance in one solution. And most of the Scribes that, if you look at their strategy, they're all looking to go sideways and add additional functionality to broaden their offering. They're all beginning to describe themselves as AI agents and co-pilots rather than scribes.
Right.
And so I think that's the logical outcome is, people are going to get a beachhead and then expand. Yeah. And capital obviously is a key to that.
Yeah. You're saying once you have market share, you can all of a sudden, you can reinvent yourself a little bit. You can go from just being a scribe to figuring out those workflow things, which is where they all are right now. They're all trying to figure out, okay, how do we become a workflow tool and not a scribe? I even saw the CEO of Nabla in the comments on, I think it was one of Brendan Keeler's posts, saying that they've actually banned their employees from using the term scribe. They don't use the term scribe ever at Nabla, and I'm sure Bridge is the same thing. And they're all but a Bridge is also, and this might speak to where the money can send you in kind of funny directions. They seem to be a little bit out there with like some of these initiatives. I don't know. They did like their marketing is has been a little more out there recently with I don't know if you saw, they did this thing called like The Conversation. They had Rick Rubin there. Like, I don't know. It was just like, that was a little confusing, that marketing.
Well, I think, our approach is actually a little different than most. So we've introduced a couple of weeks back the Affineon Embed program. So we're embedding our AI inbox into other people's products. So for a scribe that wants to...
You're taking the PayPal approach, aren't you?
Exactly. Well, that's the problem is today's scribes are very competitive, right? So they go into an RFP as an example, and how do you differentiate yourself? So by including an AI inbox, a scribe can now be substantially differentiated against its competitors, and it can drive more revenue because it can now bring another solution. And back to the earlier discussion, there's really two big problems providers are facing: documentation and the inbox. So I think this is an example where we raised quite a bit of funding, and we're able to now offer our solution not only directly to providers, but also to partners that want to embed it. And I think that it's kind of like the Intel Inside model. So we are very much excited about that. And I think that's an example of how AI in healthcare is probably going to be a little different, especially with the scribe example, given the number of players. Differentiation is going to be everything.
Yeah. I'm sure this, I don't know if it keeps you up at night, but I'm sure that this is a concern that you are constantly keeping, in your sights and probably discussing very often, which is anyone that's building an AI has to build with the understanding that they're not building for the current state of AI. They're building for where this is going at a very exponential rate. And we, I'm sure, are both, I know at Careco, we build features that will only work in, when the next, as these models get better and better and better. But at the end of the day, we don't know how far they're going to go. And so the concern is, at what point do the models get so good that essentially all kind of SaaS style products or solutions just become irrelevant, because it becomes so easy to just hook up a model to your workflow, and the model will already be so good with agents and all that kind of stuff that it'll just basically be able to accomplish all this with zero complexity at all. Is that a concern? And what are your thoughts?
Well, I think, the way I approach it, my team and I focus on 3 to 5 year kind of projections of where's the market going to be and where's the technology going to be and what does that enable. And a perfect example of this is, AI agents with speech and voice. So, 3 years ago, the LLMs were just emerging. 2 years ago, they were great when ChatGPT came out, but they were too slow to do real-time voice. And now the latency has been reduced so that you can actually have a conversation with an AI nurse. So that's an example where in a period of less than 18 months, it has gone from being, latency of 10, 15 seconds, which you can't have a conversation with, down to sub-second, where you can actually have a great conversation. So it's enabled an entire new set of functionality. I think if you can map out and sort of predict, where is technology going to be over the next 18, 24, or 36 months, you can then map that onto your product strategy and figure out how to integrate that in. And I don't think that LLMs or AI in general is going to be at a place to take huge chunks of functionality and being able to solve it without a point solution, not in the next 5 years. But I think what we'll do is it will enable very unique solutions that can be integrated into products to differentiate them. I think voice is a perfect example.
Yeah. So, the key there is that you said you don't believe that they'll be able to replace point solutions, or they'll be able to why? Why do you think that?
there's still a lot of work to be done. When you look at things like we're doing, we picked a clinically difficult problem like lab results, and the level of sophistication in lab results is so high that even though a LLM might be trained general purpose training on healthcare and certainly lab results, its ability to do what we're doing is still really, really, bad. So we have to build a system that can do it. I think the ability to do verticalized training, so you can have medically trained LLMs, still doesn't improve that problem because there's a depth of, in our case, there's a lack of training data to tell the LLM, for example, if you get a urine culture back, how do you handle that? Yep. Well, there's no pattern that it can go say, here's what you do. We had to actually train it with clinicians because the data wasn't there. So I think that's where a lot of people think LLMs just know everything. They really don't. They digest the information that's available and they can represent that. But if you present a problem that isn't well documented, obviously it won't know how to do it. And I think that's going to be the challenge over the next 3 to 5 years.
Yeah. And healthcare as an industry is not well documented. Inherently, it's not well documented, and this is a challenge that a lot of these companies are facing. I know companies like Hippocratic AI or companies that are trying to automate a lot of this stuff. I think I know that they're finding that out where they're like, hey, how is it that the same patient profile, at the same system, at the same health system, the same patient profile, one doctor at that system will tell this patient profile, they can drink orange juice, and another doctor at the same system will tell the same patient profile that they can't drink orange juice. And how do you automate something that is so, specific and nuanced? And anyway, I think
and I think to your point, though, also LLMs and AI in general need data to be able to make decisions. And a lot of people think that the data in the EHR is just perfect. So just plug an LLM and it'll do everything. But I'll highlight examples like if you take a patient and you look at the med list for a patient, just getting a correct med list is super hard. And without a correct med list, the LLM can't do anything because you're feeding bad data in. So bad data in means bad results out. And that's often what people that aren't experienced in healthcare think is, just plug it in and it'll do everything. Yeah, if you could get an accurate med list, that'd be great, but you can't. And that's the problem. So I think a lot of early stage companies going into healthcare are realizing it is incredibly hard, not because the idea is bad, but because the data isn't there to make it do what you need it to do. And then you have to solve that problem. And that's a tough problem.
Yeah. Super interesting. Well, David, this is such a fun conversation. Where can people, I imagine your customers are health systems, doctors. Where can people find you? Where can they buy Affineon?
Sure. So you can go to www.affineon.com, or you can email us at, my email is david.norris@affineon.com. And we always love talking with providers about interesting challenges. So feel free to reach out.
Awesome. Well, David, this was so much fun. Thanks for spending the time and best of luck.
I appreciate it, Mendel. Have a great day. Take care.